Hi, I'm Dr. Jatin Yegurla, consultant gastroenterologist. So, we had a case of Achalasia Cardia. Today, we have with us a case from Somalia, and he's an elderly man, around 69 years of age, who has been suffering from difficulty in swallowing food for almost 5 to 6 years, and he's been having regurgitation. He's lost significant amount of weight, and he's been going pillar to post to get his condition diagnosed and treated. So when we saw the patient, we found that he had something called as Achalasia Cardia. So this disease, can affect any age group, and this is basically the valve, the junction between the food pipe and the stomach. It is supposed to relax when we take food. Unfortunately, in some individuals, there is a persistent contraction of the muscle in the lower esophageal area, and there is also thickening of that sphincter that keeps the lower esophagus contracted and doesn't allow the food to pass through. So over several years he is not able to swallow the food, and the food pipe keeps on enlarging, and this is called as achalasia cardia. So we have several options for treating achalasia cardia, be it some medical therapy, balloon, or surgery. Surgery can be done laparoscopically or endoscopically. So we explain the options to the patient, and medications are not of great help in this condition. And the balloon is going to give only temporary relief, and best option would be surgery. The choice between endoscopic surgery and laparoscopic surgery, it depends on individual preferences and the patient profile. And our patient chose to go for endoscopic approach, where without any single incision on the skin, we were able to cut the lower esophageal sphincter muscle through a procedure called POEM. POEM is per oral endoscopic myotomy. So it was completely endoscopic, and this gentleman had a very difficult anatomy with sigmoid esophagus and lot of submucosal fibrosis. But fortunately, we were able to uh, do the procedure successfully, and now he is able to swallow the food. We discharged him the next day, and so this has been the case details, and let's hear from them, his son, how his experience has been.
Thank you, Dr. Jatin. My name is Mahmoud Jama. As Dr. Jatin said, I'm from Somalia. So my dad has been suffering from this. It has this issue for a very long time. He went to several hospitals in East Africa, mainly in Ethiopia, Somalia. He had endoscopy before. There was basically no success at all. I've been meaning to take him to India for a very long while. So last year is when I wanted to take him, but due to extenuating circumstances, I couldn't do it. But I managed to do it this year. So we brought him over here. On the first day, had a full checkup. Encouraged to see gastrologist. So we came to see the gastrology department in Apollo. He had an endoscopy, and that's when he's basically, we've been told that he has this Achalasia Cardia. So we've been referred to see Dr. Jatin and Dr. Raghu. They've been through the process with us, very transparent, detailed, encouraged us to have this surgery with the success rate of being 95% permanently repaired. My dad was a bit cautious, a bit skeptical. He was just didn't want to have the surgery, so we had to encourage him to have the surgery. We said, "This is, we got experts here. We've got the equipment. We've got everything. Everything's laid out. The evidence is there. So you have to have the surgery." He eventually went through with it. Now he's in denial that he had the surgery. He's able to drink, eat food, no vomiting, nothing like that. So it's been a successful case. I want to say massive thank you to Dr. Jatin here and Dr. Raghu. And I want to also encourage other patients who might have a similar issue do not be hesitant and listen to what the doctors are telling you and follow the process. For my dad, it's been successful, and I'm really thankful to these guys. That's all I want to say.
Thank you
Thank
so
you.
much. It means a lot, and we are able to do such complex cases in the department mainly because of the great teamwork. And I would like to extend my thanks to my department, mainly our department head, Dr. Raghu, DK, along with Dr. Bharat and Dr. Ankit. And in case you're suffering from similar problems, don't hesitate to reach out to one of us, and we will give you a detailed explanation about the procedure and what you can expect from the surgery.